So my name is Dr. Doug Wingate, and I'm an integrative neurorehabilitation specialist. I've been in clinical practice, private practice, since 2011, and utilizing a number of different modalities in different forms of neurorehabilitation. And today we're going to talk about how to tune up your brain. So how neurobiomodulation and passive neurofeedback can help the brain reset itself and break out of unhealthy patterns. So before we get into talking about this a little bit, of course, a little disclaimer that everything that's being discussed today is for educational purposes. It's not meant to diagnose or be any sort of prescription for a particular condition. If you're interested in these services, if you're interested in any of the therapies that we talk about, to be sure to consult with your healthcare provider for any sort of medical recommendations to see if it might be a good fit for you. So before we get started talking about kind of the ins and outs of the therapeutic approaches, probably be helpful to define some terms first, especially neurobiomodulation. It's a long word. It may not be clear right away. So if you break that term down, of course, neuro means it's relating to the nervous system or with the brain. And a lot of what we'll be talking about today is going to be centered around working with the central nervous system in the brain, re-regulating the brain. Bio means biological or related to the body. And so in this case, what we're going to be talking about with neurobiomodulation is an intervention that is able to modulate. So that third portion of the term, to modulate or modulation means to introduce change or allow for change or adaptability within both the nervous system, the central nervous system, the brain, and the body. So, according to the International Neuromodulation Society, neuromodulation on its own is technology, any technology that acts directly on the nerves in it's the alteration or modulation of nerve activity by delivering either electrical or pharmaceutical agents directly to a target area. We're going to expand on that definition a little bit. We're going to talk about electrical interventions, but we'll also talk about a few other interventions that are out there that don't necessarily use that. So we'll talk about magnetic stimulation and laser or light stimulation as well. Neurobiomodulation is refers to a fast evolving field that harnesses low intensity electrical impulses in order to regulate and restore neuronal activity. And so it targets maladaptive brainwave patterns, supporting neuroplasticity, and we'll talk about neuroplasticity a little bit. The brain's ability, briefly, it's the brain's ability to reorganize itself through new neural pathways. So, neuroplasticity is your nervous system's or your brain's ability to adapt or change or create new neural connections or create new patterns. And we're going to talk about different methods that can be helpful in promoting that. A neurofeedback is a term that, according to the International Society of Neuroregulation and Research, refers to a therapeutic intervention that uses a brain-computer interface. So, an individual's brain waves, their brainwave activity is tracked in real time. So there are sensors or leads that are put over the scalp, and we get real-time reading of what the brain is doing, of the brain's activity. It's then interpreted with what's referred to as a decoder, and then that information is used to encourage the person to modulate specific brainwave activity through feedback, or what's referred to as an effector. So neurofeedback can also be referred to as EEG-based biofeedback. So biofeedback is any intervention that takes reading of the body. So for instance, you may be gauging heart rate or breathing rate, respiratory rate, and things like that. And then by getting the information and becoming aware of that, there are things that you can do in order to help regulate that or modulate that on your own. And the same sort of thing goes for neurofeedback, where we're getting this real-time reading of what's going on in the brain. And based on that, we can take that information and allow for an opportunity for change. So, a lot of what we're going to talk about today is a form of neurobiomodulation that I use in my private practice. It's a system referred to as Neurogen Brain balancing. And it's a novel, passive, non-invasive neurobiomodulation modality for brain health. And so it's uh, what it means by non-invasive neurobiomodulation technology is it's designed in order to optimize brainwave function and restore neurological balance. So unlike conventional neurofeedback, where there are sensors and we're getting EEG readings of what's going on in the brain, and then there's active participation, and the feedback portion of that is reliant on the person that's receiving the therapy. So they're usually looking at a screen, and or there are audio tones, or there's some sort of sensory um, mechanism that they're responding to. And so then they make the conscious effort to modify that, to modulate that on their own. Unlike conventional neurofeedback, Neurogen Brain Balancing um, delivers therapeutic benefits passively through a low intensity pulse transcranial electrical signaling and EEG guided protocols. So what that means is it's completely passive. The person receiving the therapy doesn't really have to do anything other than be there and show up. And the practitioner and using the technology, the Neurogen system, basically does all of the work. We're getting the information about what your brain is doing. The system analyzes that information and determines what therapeutic electrical signal is going to be most adaptive for somebody based on that information. And so it does all of the work. We, as a practitioner, has the awareness of what protocols we may want to do, how much work we may want to do over a particular brain area, depending on what's coming in, what symptoms people have, or what they're wanting to work on. So it's highly adaptable, but it's completely passive on the part of the person receiving the therapy. So you could be sleeping. There's been work with individuals in a coma. And with that, we'll talk about a few advantages that that has just as far as accessibility. So with the Neurogen unit, by leveraging the brain's inherent neuroplasticity, again, that's the ability for the nervous system to create new neural connections and to be more adaptable. NGBB, or Neurogen Brain Balancing, offers a scalable, non-invasive solution for neurological rehabilitation with potential applications across diverse clinical populations. And we'll talk about what some of those populations are. So what that means is that it opens up possibilities to be more accessible for those where other interventions might not be appropriate or might be too much for somebody at any particular time. So, quick note on neuroplasticity. We already talked about a little bit. It's the brain and the nervous system's ability to change and rewire itself. It's also been known or referred to as neural or brain plasticity, the nervous system's ability or capacity to modify or change its activity in response to intrinsic or extrinsic stimuli. So that means is whether or not we're having sensory experiences internally in our body that we're responding to, or whether or not there's something outside in the outside world that we're getting information about. Both of those will influence neuroplasticity. And by reorganizing the structure, the functions, and the connections within the nervous system in response to whatever stimuli it may be. So by understanding and harnessing neuroplasticity, it has significant implications for developing therapeutic strategies aimed at enhancing cognitive function, learning, memory, and facilitating recovery from neurological disorders. And we'll touch on a number of those as we go through this material and how this intervention can be helpful in promoting cognitive function, learning, memory, and then how it applies to certain neurological disorders as well. So in short, how Neurogen works is the signal is transmitted through three small leads. It's referred to as a ground lead, active, and reference leads, or negative leads, that are placed up to 19 different specific locations on the head or the neck that correlate to specific symptoms. So a lot of these are related to knowing if symptoms tend to be a dysregulation in a particular region of the brain, that we can really emphasize or work on that and use this intervention to help guide the brain into what's called better coherence, where there's better communication, there's better adaptability, and we're able to work with that neuroplasticity to guide it to be helpful in alleviating symptoms. So the leads, these are just small wires that are attached to the scalp that take in electrical information from the scalp in the brain area under which it's attached, and it also sends a signal out in response to that information. So the leads read the client's brain waves and record the signal in a computer and in an EEG processor. And then they also generate the electrical stimulation feedback back to the brain using a low power feedback frequency. This is a very, very low frequency that's used. It's generally imperceptible. Some people who are particularly sensitive might have an awareness that it's on or when it's sending a signal out, but most people aren't even aware of it. It's 3 picowatts microcurrent, which is just a fraction of the intensity of electricity that comes off of your cell phone. So if you have a cell phone in your pocket, you're receiving technically more electricity in terms of power that from that cell phone than you are from this system. But this system, because it's very targeted in the frequencies that are being sent, are able to modulate the nervous system, get that response within the nervous system with a very low powered signal. So it's a very low power, very specific symbol. Frequency. So if there's a normal beta brainwave, and we'll talk about what beta brainwave means, but there are basically different brainwave frequencies at which the brain operates, alpha, beta, theta, deltas, and gammas. Um, and so the information that's coming in from this system through the EEG leads, if there's a normal beta brainwave, there's no stimulation that's generated. It's considered coherent, or the brain is communicating in an effective way that doesn't warrant any sort of stimulation. So it's able to gauge if things are functioning pretty well. Then there's no need to do any sort of intervention over that particular area. And typically we're working multiple areas within a single session. And so we'll just move on to the next session, next region, and have an awareness that that particular area of the brain seems to be functioning very coherently and communicating very effectively. If there are abnormal brain waves, then it generates a feedback pulse 1 hertz higher than the information or the level of incoherence that it's reading in order to recalibrate it back into the normal range. So it's taking a real-time reading of what the brain waves are doing. If it finds that that communication is not as efficient as it could be, or if there is coherence, then it offsets the frequency based on where it's at in real time. And that's real time adaptive, meaning the exposure time or the treatment time over a particular area goes in 30-second increments. And over that 30 seconds, it's continually reevaluating and reassessing the information that's coming in. So as your brain is responding to the therapy in real time, the therapy and the system is responding to that response. And so it's continually taking into account and adjusting for how your brain is actively working in any particular area and how it's responding to the therapy. So the objective of the therapy is a balanced brainwave state that enables the brain and the nervous system to learn and regulate itself and to modify unhealthy patterns by promoting the formation of new neural pathways. So rather than forcing it to do anything, it's gently guiding the brain into a means of how the brain can reorient and recalibrate and reorganize itself in a healthy way so that it's responding to everyday life and resolving the symptoms by allowing the brain to re-regulate itself. So we're going to compare this to a few different other modalities that are out there, a few other different therapies that would also be considered non-invasive brain stimulation or a means of stimulating or working with the nervous system directly without doing any sort of non-invasive means it's nothing that involves surgery. So there's things like deep brain stimulation that are used for certain neurological conditions, and we won't be getting into any of those. Obviously, those require surgery or much more involved in terms of recovery time and things like that. So we'll talk about some forms of non-invasive brain stimulation and how they kind of differ. We already mentioned would be considered conventional neurofeedback. So similarities are that neurofeedback systems are gathering EEG data based on different areas of the scalp through leads. The difference being that conventional neurofeedback requires a screen or requires tones or requires some sort of stimulus that the person receiving the treatment is actively engaging with, and the onus of modulation or change lies on the client having to do everything. So responding to that information and sort of retraining the brain ch- um, can be a really helpful tool for many individuals. It also is not necessarily appropriate for everybody for a few different reasons. So, big difference between conventional neurofeedback and neurobiomodulation is passive as opposed to the active participation. And with neurobiomodulation, the neurogen brain balancing, there's the real-time passive adaptive feedback. So while the feedback is in real time with conventional neurofeedback, um, we're again just that the neurogen system is adapting in real time as well and continuing to analyze the information that's coming in response to your brain's response to the therapy. So I kind of mentioned this earlier, but a difference here is that Neurogen allows it to be used across a diverse populations that you may not be able to apply conventional neurofeedback to. So I didn't really mention, I did mention that there's the body component. This system can also be applied not just to the scalp, but over areas of the body as well. So I've used it for chronic inflammation patterns, because it is sending a low current electrical signal. It can be used almost like a smart TENS unit over certain areas of the body if there's chronic inflammation or chronic injuries. So I've used it over the back, the neck, the shoulder area for frozen shoulder, things like that. Um, and that's one area where there would be a difference. You can't really do that with neurofeedback. Because it's passive, you're able to work with all ages. So you can work with infants who wouldn't be able to engage with any sort of screen or anything like that, wouldn't be able to even think about what to do with the information. So being able to work with infants is fantastic. I've worked with a number of very young ones with Neurogen, and they respond quite well. Their nervous system is very adaptable. It's already in a high state of learning or high state of neuroplasticity. So have had really fantastic results. Also with neurodivergent children, people who are on the autism spectrum or ADHD, and it's not just children. I work with a lot of neurodivergent adults as well who respond very positively to this, and we'll kind of talk about how that fits in. But with neurodivergent children, sometimes getting them to be attentive enough and have the attention span to engage with the conventional neurofeedback can be problematic. And with the neurogen brain balancing, we're able to do the work for them and guide that nervous system more into regulation. And when it comes to working with neurodivergent individuals, a lot of the therapeutic benefit is with regulation. So when there's acute dysregulation, when there's combativeness, or it certainly helps with, as we mentioned a little bit before, cognition or brain fog or memory and things like that, and just overall functionality. But also when there's acute dysregulation, it can be really helpful tool. Um, because it's completely passive, you're also able to use the system on horses and dogs and animals. I haven't heard of them being used on other animals beyond dogs and horses, but there's a practitioner down in San Diego that works on horses on a regular basis and says that it responds very positively to the system. So obviously, animals wouldn't be able to interact with a conventional neurofeedback. And then for my own practice and a lot of the people that I work with, neurocompromised individuals. So people who may have a history of neurotrauma. I work with a lot of people who have had history of concussion or traumatic brain injury or stroke. And they're not always in a place where they can actively engage with a system like conventional neurofeedback. That might be because of cognitive impairment for whatever reason as a result of the neurotrauma, or it may be just not just, but it may be neurofatigue, a situation where screens can be overwhelming or overstimulating on their own. Auditory input can be overwhelming on its own. So I have people who have a real hard time with sounds overall, and so that can be overwhelming for their nervous system, and it can be really depleting. And they may not be able to engage with that for very long. The visual input with the screens can be at times overwhelming for the nervous system, and so people either uh, not feel like they have the energy to even do that, or afterward they may feel really fatigued because it's put a lot of strain on the system, and their system is already strained. The brain is such an energy expensive organ in the body that as that is healing after something like a neurotrauma, it's basically consuming much of the energy that your body has. And so we've got individuals who sleep 12, 14, 16 hours of the day during their healing process, and then have enough energy to maybe do one or two tasks throughout the day. And that's about the energy that they have. So engaging with a system like conventional neurofeedback may be too much for them at that time. And of course, goal of therapy is going to be to expand that window of tolerance where their nervous system is better regulated, clears out inflammation, and more adaptable so that it may be able to engage in more activities and possibly get to the point where they would be able to engage with conventional neurofeedback if that seemed like the proper direction. Um, yeah, so where screens and exercises might be too demanding, and then also people who have low functioning levels of consciousness. Briefly mentioned this before, but people who are in a coma. I haven't worked with individuals in a coma myself, but there are a couple practitioners that I have talked to who have worked on individuals in a coma, as well as people who have severe traumatic brain injury, where their functioning is impaired to the degree that they might not be in a place to actively engage with conventional neurofeedback. So Neurogen opens up a lot of possibilities as far as who is able to receive this therapy. And as we'll see, we're able to adapt the therapy according to where somebody is at, how much stimulation is being given, or how much information is being given, um, so that it's not too demanding on the nervous system. So we gauge that over time. Another form of non-invasive brain stimulation that's out there that's become fairly commonplace is TMS, or transcranial magnetic stimulation. So rather than using an electrical signal, rather than using active engagement by the person, TMS uses a very strong magnet in order to stimulate areas of the brain. So it uses high current magnetic stimulation, produced by a magnetic coil that's placed over whatever area of the brain they want to work on. It can be used to be inhibitory, so they'll use low frequencies, less than 1 hertz, in order to inhibit an area of the brain. So if one area of the brain is firing too much, it's overactive, or it's really there's a lot of inflammation or a lot of overactivity in that area, then they would use a low frequency in order to inhibit that area of the brain. Or it can be facilitatory using a higher frequency, so above 5 hertz will help activate or turn on an area of the brain and allow that area of the brain to fire and become more active. So the way that TMS kind of works is through a neurotransmitter called glutamate. Glutamate is the primary excitatory neurotransmitter in our brain. So when there's activity going on, when the brain is becoming excited, that is often attributed or a response to glutamate in the system. And so TMS works on glutamatergic neurons, glutamate neurons underlying the cortex, so the area of the brain that's underneath the area of the scalp. The magnet doesn't actually touch the scalp; it's put over the scalp. So it increases firing of glutamate neurons, and it inhibits or decreases neurotransmission of GABA. GABA is the primary inhibitory neurotransmitter. So you have glutamate that activates areas of the brain or activates activity in the brain, and GABA that inhibits activity in the brain. And a lot of our brain's function has to do with inhibition. So when there's situations like disinhibition through different areas, then we can have situations where sensory overload can happen. So we don't have our filters that our brain would normally have, and it can become rather overwhelming. So TMS is a strong magnet that's placed over the area of the brain. And because of that, the strength of the magnet actually causes the neurons to fire. So a number of the interventions that we're going to talk about are lower intensity than that. They don't force any neurons to fire, but they would be called lowering the threshold of the firing rate or the frequency of fire. So TMS is very strong in its approach, and it's been used for a number of different symptoms. There's a lot of talk around TMS for depression and using TMS over an area of the frontal lobe, in particular the left dorsolateral prefrontal cortex. So kind of this area right here. Um, and reason for that is that if that area is not firing enough, then you can use TMS to sort of force those neurons to fire. What I run into in my practice is that again, I work with a lot of people who have history of neurotrauma and their nervous systems are pretty compromised. And so this could be another intervention where it may be too much at any particular time. It might be too demanding for the brain. Again, over the years, I've had a number of people who have had TMS as an intervention. It's not one that I offer in my clinic, but the they were not in a place where their nervous system was stabilized enough to integrate in the TMS, and it was too much for the nervous system at that particular time, and so it actually made symptoms worse. And so while there's ample research for where TMS might be appropriate, there are also situations where it may not be appropriate, and that sensitive nervous system, that hyperactive nervous system, might be one of those. So again, Neurogen is self-adaptable or programmable offset frequencies. So you can adjust the frequency with TMS, but it's not nearly as adaptable. And then Neurogen, again, because it's a low intensity pulse stimulation, it's usually imperceptible. And with TMS, there can definitely be some sensation associated with it. And there can also be, if the stimulation is a bit much for the nervous system, I would kind of compared to the other things that we're going to be talking about, TMS is kind of a shotgun approach. It's a very strong kind of very direct stimulation to force those neurons to fire, as opposed to neurogen or some of the other modalities that we're going to talk about that lend themselves more to people who are more sensitive or are neurocompromised and aren't quite to a point to be able to integrate or even handle that intensity of stimulation. Next one that we'll talk about is RTDCS, or transcranial direct current stimulation. R just refers to repeat, so repeated transcranial direct current stimulation. Conventional TDCS uses an electrical signal placed over different areas of the scalp, and technically Neurogen would fall into the category of TDCS because it is using an electrical signal, but there are some key differences between what conventional TDCS and what Neurogen is doing. So with you can see some of the systems over here on the right side of the slide. They tend to be kind of crude in design. So that top one has very broad areas that you're working. So you're using a node on the frontal lobe there, and it looks like the left parietal lobe. And then it's hooked up to a box that is very similar to if you're familiar with a TENS unit. It sends out an electrical signal. You were able to dial in what the intensity of the electrical signal and what frequency. Um, and then you can see the picture just below that there are devices now that are less crude and cover more areas simultaneously. But it's still a situation where particular signals are being sent in, particular electrical stimulation are being used. Because it's just kind of placed over the leads, and the intensity tends to be more so with conventional TDCS. You can certainly feel it. So it feels, again, if you're familiar with a TENS unit, you can really feel when that's stimulating the area. You can feel the electrical signal coming in. And it's the same sort of thing with most TDCS systems. So it does stimulate or influence brain excitability using a low level of continuous electrical current. Two or more electrodes are placed on the scalp with the current going from what's referred to as the anode and the cathode. It's basically a positive and a negative, in which the frequency runs between. So in order to create a full current, both of those need to be on and applied to the scalp. And then the current basically goes between those two different areas. Neurogen, on the other hand, there's 5 to 9 nodes that are placed on the scalp or the body simultaneously. So you're not just working two areas. Like I said, on the bottom image there, you can see multiple areas being worked as well. With Neurogen, we're working not only multiple lead sites simultaneously, but within a single session rather than just setting up a system to two areas. We're moving the areas of the brain that we're working throughout the session. So as I mentioned, there's 19 different standard areas over the scalp. Often during a session, we're working up to 15 different exposures or 15 different locations within a single session. You may focus on just one area if that's most appropriate, but there's also protocols. One of those is referred to as the total brain balance, where 13 different locations are all stimulated or all worked with and all assessed within a single session. And this allows to basically give your whole brain a tune-up. It works the whole central nervous system, the whole brain. And then those protocols are able to be modified if it's appropriate. So if particular symptoms are standing out, we're working on something in particular, then we can modify that over time. We almost always start with a total brain balance, unless for whatever reason it's pretty apparent that that's not the appropriate way to start out. But the total brain balance works very well to kind of clear the fog and allow for more systemic re-regulation and assisting the brain in that sort of giving it a full brain tune-up. And with that, sometimes certain symptoms can kind of clear the way or resolve themselves, and then we can gear or transition the treatment to focus on what remains. And that can also be really helpful when in situations like brain fog or cognitive fog, or general inflammation in the nervous system after a neurotrauma or something like that. So total brain balance is able to, again, just work the whole brain, multiple areas within a single session. Each location is assessed for the response. So if there's an area of the brain that is not responding as efficiently as the others, or when we start getting the EEG readings, there's more incoherence and it warrants more time, then we're able to put more attention on that area. So we can gauge in real time if we need to give more stimulation to a brain area based on how it's responding, which is not something that you get at all with conventional TDCS. You kind of run the electrical signal, hope for the best, and ask for them to report back on how their symptoms are doing. So there's no EEG involved. We're not getting real-time feedback like that. And we already talked about the real-time adaptable frequency offset. So that is something that differentiates itself from conventional TDCS. Another form of non-invasive brain stimulation that's out there, it's a little bit different, is PBM or photobiomodulation. Photobiomodulation uses light frequencies, so different frequencies of light. There are different lasers out there that run different frequencies. And so you're able to use a specific frequency laser to stimulate the brain tissue through the scalp. So they've done all kinds of research to see how deep the laser light will penetrate through. Every cell in our body contains what are called photoreceptors that respond to light. And so the cells on your scalp, the cells on your skull, and the cells in the brain tissue underneath the skull all respond to light in different ways and can be stimulated. And that's what PBM does. And said there are a number of different frequencies out there. Some penetrate deeper than others. The strength of the laser comes into play. But it has been demonstrated that the brain tissue below the skull responds to PBM if you're using the proper type of laser. And so it's a different way to stimulate the brain. Um, you are able to work multiple sites simultaneously with photobiomodulation. So the picture that you can see here is just a handheld laser device. You can hold that over an area of the brain to stimulate that for a period of time and then move it to different areas over the scalp as you're working through a session. And then there are also other devices. I have one in my clinic that has 12 different leads that we're able to hook up to different areas of the scalp simultaneously, or areas of the scalp and areas of the body, because there are areas of the body that can help regulate the nervous system or clear out inflammation. Photobiomodulation can be very effective at clearing out inflammation as well. So an example of that is we may put some over the scalp, put one or two on the ear. And the reason for that is the vagus nerve, which vastly innervates all of our internal organs. And there's been a lot of conversation around vagus nerve regulation and vagus nerve stimulation. And one way of doing that is through an area on the ear, because the only portion of the body where the vagus nerve comes out to the external surface of the body, out to where the skin is in the inner ear. Well, not the inner ear, but a portion of the ear. And so by stimulating that area, and you're able to do that with photobiomodulation, that helps regulate the vagus nerve, which feeds back into the rest of the brain and influences how the body functions. So you can use that as well if you're doing photobiomodulation. You can apply neurogen as well. It leads to the ear too. Photobiomodulation is also pretty much imperceptible to most people. Again, if somebody is particularly sensitive to sensation, they might have an awareness. They might feel a little tingle over the area that's being worked, but for the most part, it's imperceptible. And something about PBM is that it can be mutually supportive and used in conjunction with Neurogen. That's something that I do fairly frequently when I'm working with people. That can be putting leads over the scalp to help stimulate the brain. That can be putting lasers on different areas of the body to help regulate the nervous system. One way that I'll often pair those two therapies together is through intranasal photobiomodulation. So there's a device called a V-light that I'll often use that has a bulb that tucks into the nostril and applies the laser through the nose to stimulate the brain. So the membrane between the nose and the brain is really thin. And so it's the most accessible way to stimulate the brain with the most potency. And so that works really well together. Is I'll set people up with an intranasal photobiomodulation at the same time that we're doing neurogen, and that works really well together. The intranasal option increases mitochondrial function. It stimulates the cells within the blood that's already passed through the blood-brain barrier and is circulating throughout the brain. So it increases oxygenation and improves the availability of that oxygen through improving circulation and improving mitochondrial function in the brain. So one way that those things can actually be complementary and used together. So as I mentioned before, Neurogen works with different brain waves. We're able to see in real time what the brain is doing when I'm working with somebody. So this isn't the greatest picture of the screen of what we see when we're working. But I did mention delta, theta, alpha, beta, gamma waves. And Neurogen works on each one of those, or we get feedback on each one of those, with the exception of gamma. Gamma is the highest frequency that the brain waves tend to work on. It's more associated with states of mind having to do with insight or peak focus or really like flow state type concentration or expanded states of consciousness. And so that's not really accounted for in the neurogen system. If I'm working and wanting to work with gamma frequencies for the brain, I'll often use audiovisual entrainment, binaural entrainment systems that I have. And so that will use LED lights that are synced up to binaural audio frequencies that help with communication through the different hemispheres of the brain. But Neurogen gives us real-time feedback on the alpha, beta, theta, deltas. Beta waves are more associated with alertness or concentration and active cognition. So by regulating beta waves, it can be helpful in facilitating with cognition or benefiting cognition. Alpha waves have more to do with relaxed states or when you're visualizing or with creativity. Theta waves are even lower frequency, so we're kind of working our way down in terms of the frequency rate at which each one of these works. So theta is more associated with meditation or intuition and memory. And delta waves are more associated with deep relaxation or sleeping or REM sleep or healing states. So we are able to see each one of those in real time. Neurogen actually delineates so that we can see beta, high beta, and low beta as well. So we can see how each one of those are functioning over whatever area of the brain we have hooked up to the system. And again, see where those aren't communicating properly, where there's what's considered incoherence between those. And then the system is analyzing that data, um, modulating the signal that's being sent out in order to promote better communication, better coherence. In addition to that, there are different waveforms or different patterns that we're able to work with Neurogen. So there are several different levels or settings at which we can utilize different waveforms in order to help assist or help guide the brain back into better coherence. So different waveforms are used in order to gently introduce variation into the brain's activity. The small controlled dose of novelty or graded levels of entropy help loosen stuck or overly rigid brain patterns and gives the nervous system an opportunity to reset itself. So each one of these waveforms or different levels, and they're not linear levels in terms of intensity. They kind of start out that way, and then there are different forms. But each one of those is introducing different levels of information. How much information? Another way to think about this is if something is, if you think about something that's stuck in place, you kind of have to uh, jiggle it around a little bit. It's the amount of entropy or novelty or information that we're introducing to the brain is how much we kind of jiggle things in order to allow them to break out of these patterns or fall back into place. And so we almost always start at a level two. Level one is very, very gentle. So if we're working with infants or people who are very compromised, immunocompromised, we may use a level one. But a level two, most people will start out with, and that tends to be pretty gentle. We want to make sure that the body and the nervous system is able to integrate that in before moving up to another level that introduces more information. So we want to make sure that we're not overwhelming the nervous system. And as we're working with people and their nervous system becomes more regulated, we're able to change things around and use different waveforms depending on how much information or how much we want to ask of the nervous system to do so that we're not overwhelming it, but we're continuing to move things forward and gently guide it forward toward better self-regulation. So again, the goal is always to be working to getting the brain to regulate itself again, but it often gets stuck in these patterns that just kind of feed into themselves. And sometimes it needs this entropy. There's a whole conversation around the entropic brain theory and how using different different interventions to introduce novel information or introduce entropy allows for change to happen and allows for that healing to happen. So this is the one of the ways the neurogen is able to be very adaptable in how much we're asking the brain to do at any given time. So by changing the rhythm and the shape of the stimulation, the brain's encouraged to communicate more flexibly and efficiently. The different waveforms gently perturb rigid or maladaptive neural patterns. So that means it breaks it out of that pattern and allows for it to shift out of that pattern that it's established. So by varying rhythm, amplitude, and complexity, stimulation can nudge the neural networks out of entrenched patterns, supporting recalibration of cerebral communication. So it recalibrates the way that the brain is communicating with itself, network flexibility, and functional coherence. So rather than forcing the brain to change, the brain is supported in its own natural ability to reorganize, adapt, and restore balance within itself. It just kind of gives that little nudge. That last slide mentioned brain networks, and this is one area that Neurogen is also able to work with because of the way that it's set up. And as I mentioned, we're using multiple leads simultaneously, and um, we're able to take into account. So if we're working with a particular symptom and somebody has visual issues that they really want to work on. So I work with a lot of people again with post-concussion. They have visual issues after that, or their vision is not adapting or integrating the visual information appropriately. And so that can lead to all kinds of other symptoms, dizziness and balance issues, etc., headaches and things like that for sure. Is that if we have an understanding of how the brain works as a network, that brain areas don't work in isolation. So while there is the visual cortex in the back of the brain in the occipital area, there are a lot of different areas of the brain that process that visual information, and we're able to take that into account and work those simultaneously. So we may set up a couple leads over that visual cortex and then a couple leads over, say, the frontal eye fields or the supplementary eye fields that are closer to the frontal lobe and the parietal lobe. But we know that those areas of the brain are directly communicating with one another and mutually supporting each other. And so we're able to take a more networked approach to working with the brain, which is how the brain functions anyway, is through the different areas and how they communicate. And so more and more as therapies like this are gaining more understanding of how the brain works. Uh, there are papers on all of the other interventions that we talked about and how those have a networked effect. So if you are using TMS over the frontal lobe for depression, that's going to have an effect on the other areas that the brain that area of the brain communicates with. With Neurogen, because we're working multiple leads simultaneously, we're able to actually stimulate those different nodes or those different regions so that they're communicating even better and support that regulation overall through a system approach. As far as frequency of sessions with Neurogen, it's usually start people out once or twice a week, depending on what they're coming in for, what their symptoms are, how severe the symptoms are, how long it's been going on. So if somebody has had a neurotrauma and they're coming in with post-concussion syndrome, I'll usually start them out twice a week. Um, if it's a real persistent migraine pattern, I'll usually start them out twice a week. If it's something like they're wanting to work on better sleep and better regulation of their sleep cycle, we can usually start them out once a week. So it kind of depends on where they're at, but that's usually where we will start. Treatment can be done as frequently as daily. So if somebody is really in a state where we want to try to make as much headway as possible, I may have them come in more frequently than once or twice a week. Or I have people who travel from out of state and we'll do intensives. So we'll do multiple treatments throughout the week, give a few days, and then maybe do another intensive several days through the week. So it can be applied as frequently as daily. Don't want to be doing it more than once daily. A lot of the reason for that is the information that the system is asking your brain to do in order to recalibrate and re-regulate itself is integrated during your REM cycle. So as you're sleeping. So if you don't have a sleep cycle in between sessions, the body in the nervous system doesn't have a chance to integrate that information in, and it can be asking too much of the nervous system all at once, and then you can have some negative side effects that may show up. So you may experience dizziness, disorientation, nausea, or even vomiting if you ask too much of the nervous system, which is also part of the reason we start with a level 2 to make sure that the body is able to integrate that in before we start using any of the other different waveforms. If somebody is starting to come in for a session, it's not uncommon for an initial session to very briefly experience some what might be described as disorientation. I'll speak to my experience the first time I got it done. So about 10 minutes after the first session, um, the world just felt kind of wobbly for about 10 minutes or so. I've had some other people who have come in acutely dysregulated with their ADHD symptoms, and they're just overstimulated. And sometimes it will take 10, 15 minutes and they just want to sit down and have some water and just kind of their brain is recalibrating in real time. So while most of that integration does happen during the REM cycle, right after the session, there can be a little bit of a disorientation or a recalibration period. And it's usually not problematic at all. It usually doesn't have any sort of nausea or dizziness or anything like that. But there can be that short adaptive or adaptation period. And then a lot of the time, again, depending on what we're working on, how long symptoms have been there, how chronic the condition is, most of the time we're doing 5 to 6 treatments and then reevaluating whether or not we want to move forward. So most of the research that's been done with Neurogen related to PTSD and migraine, and I have upcoming talks on each one of those over the next few weeks. So if you're interested in that, definitely tune in and we'll talk about those in more in depth. Um, but with those research studies, we're doing treatment regimens of 5 or 6 treatments and seeing marked results and marked improvements. And so we usually set people up. Some people start responding very positively in 1 or 2 sessions. What I really like about Neurogen is that it tends to be quite efficient because of the adaptability of it and how it's able to work the whole uh, brain overall to help it regulate itself. The response time can be very efficient for even long-standing chronic symptoms and situations. So we'll usually reevaluate after 5 or 6 treatments. A lot of people will experience significant changes or benefits within that time, and then we can see whether or not it's appropriate to do more. So some areas where Neurogen might be able to help, we kind of touch on each one of these, I think, throughout the talk, but ADHD, ADD, again, with neurodivergencies, a lot of that has to do with the ability to regulate, or if somebody is in a dysregulated state or an overstimulated state. I've had people respond incredibly well to just a single session if they're coming in dysregulated and overstimulated. So we'll do the session. The session lasts about 20, 25 minutes or so. And I've had a number of people just say they are blown away by how quiet and calm their brain is right after a single session and helping re-regulate. So it can be very helpful in that regard. Addiction support. So if somebody is working with eliminating a substance and with addiction type situations, it can be supportive in regulating the nervous system so that it's less reactive. Anger or hyper emotionality overall, it can be very helpful again in down regulating the nervous system so that those emotions don't tend to be as uh, robust. Anxiety for much the same reason. There's different protocols for um, different emotions or different feelings. So there is an anxiety protocol that works on areas of the brain that have to do more with anxiety than, say, anger or fear responses or trauma responses that tend to be more locked in some of the deeper brain regions of the limbic system. So we're able to, again, cater that to what's going on. Academic performance, it helps boost cognition. It helps increase brain activity and increase the efficiency in which the brain is working. So we've had people come in and have neurogen sessions just to like get them through finals or get them through their thesis paper and things like that. So it can be used to help in academic performance and similarly with athletic performance. So we have practitioners who work with professional athletes using this system. And because we're regulating the central nervous system in the brain, that sends and makes information or yeah, makes communication with your body more efficient. And so by helping out the brain, you're helping out the body at the same time. So the brain is working more efficiently, the body becomes more efficient as well. And then autism, very similar to what we talked about with ADHD. I do see your question, Pauline. I'll talk about it in just a second because we're getting toward the end. Chronic fatigue, situations where there's chronic inflammation. Again, after a neurotrauma, if there's a lot of inflammation in the nervous system, the system can help clear some of that out. With concussions, traumatic brain injury, we talked about a variety of ways in which this can be helpful. I am actively pursuing a research grant right now to look deeper into the mechanisms and the efficiency or efficacy of the system for people with post-concussion syndrome. I work with them all the time and utilize this system. They respond very well. But we're working on getting some formal research grants on that going. Depression, and again, breaking out of some of those rigid patterns that the brain can get locked into, which is very common with depression, these thought patterns that people kind of cycle through that we can get very stuck in. Neurogen can be helpful in breaking out of those patterns. Fibromyalgia, the centralized pain conditions where pain is felt throughout the body, um, whether or not due to central sensitization, fibromyalgia, a number of different situations where those chronic pain conditions may be going on. Any sort of pain is processed through the brain, and so we're able to work over those particular areas that feed into those pain loops, and we're able to break out of those pain loops as well. Helping with executive function is very similar to the academic performance. Executive function having a lot to do with the higher cognitive functions, so things like multitasking and making judgments and error assessments and things like that. And so by increasing the communication throughout the brain and making that more efficient, executive function or executive dysfunction is a common issue that people will be experiencing, especially after things like a concussion. Focus and brain fog, again, increasing cognition. If there's inflammation, that can often be a cause of brain fog or foggy cognition, and have had a lot of people respond very positively as far as brain fog goes. Insomnia, one of the first things that a lot of people notice after getting sessions is an improvement in sleep. So it can be very helpful in that regard, helping with memory, both working memory and short-term memory, which can be commonly affected again in concussion, but also when it comes to things like neurodegenerative disorders or when memory is impacted by stress and the nervous system is very activated by helping down regulate that nervous system. Migraines, again, I'll be talking explicitly about migraines in depth in a couple of weeks. And we just finished up a research study taking a look at this system in migraines. And that's a paper right now that's being actively edited and it's in the final edits and will be published fairly soon. OCD, PTSD, again, be talking in depth about PTSD in 2 weeks, I believe. And the research that's been done on that and the paper that's already out on that has shown significant improvement in PTSD symptoms. And a lot of the individuals that I work with also have history of various traumas, PTSD, complex PTSD, and are able to get uh, relief in a lot of the activation patterns. Traumatic brain injury, we've talked about stress, stroke recovery as well. So if a stroke has impacted a particular area of the brain, we're able to focus on that area of the brain and help recovery while simultaneously being able to help with the global or the whole brain balance or recalibration. And then Tourette's is listed here. There's a particular area of the brain that is associated with Tourette's symptoms. And it's not listed on here, but in a very similar vein and similar brain area, movement disorders as well. And so there's been uh, anecdotal situations where people with Parkinson's have had improvements or a lessening or even a discontinuing of the shake that can come with Parkinson's. So we've got Parkinson's protocols or basal ganglia protocols in place and have been able to see improvements in different motor disorders as well. So that is about what I've got. Like I said, over the next couple of weeks, I'm going to be doing a couple more talks, talking about how this can be applied to specific things. Next week, I'm going to talk about how it can be used in conjunction with psychedelic assisted therapy, which is a realm in which I work. Um, And then the following week, we'll be talking about how it can be applied in PTSD and traumatic brain injury more in depth. And then the following week, we'll talk about how it can be applied in migraine. So if you want more information, my information, my clinic, and more information on Neurogen can be found at acuneuromodulation.com. More information about the system itself and how it works can be found at neurogenbb.com. There's a lot of testimonials on there as well and links to research studies that have been done. So you're welcome to check those out.